Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Did you know that your posture and alignment plays a major role in your bones and overall health? Well, today we're going to delve into this topic and exercise with a very special guest, Sara Meeks. And Sara is a physical therapist who has specialized in the management of osteoporosis and spinal pathology since 1984. She is an American Physical Therapy Association certified geriatric clinical specialist and a certified Kripalu yoga instructor. She is the creator of the Meeks Method, a comprehensive 12-part program for conservative management of people with osteoporosis, low bone mass, postural problems, and back pain. She has trained over 11,000 physical therapists, medical and exercise professionals in the Meeks Method. She is the author of 2 books on bone health, and she is working on the next editions, plus a new book on yoga and yoga-inspired movement and exercises for better bone health. In today's talk, Sara enlightens us to the importance of exercise and postural alignment when it comes to our bones. Make sure to stay to the end where she gives us some great tips to improve our comfortable sitting posture and breathing. So stay tuned. Welcome, Sara. I am beyond thrilled to have you here. It's the end of National Osteoporosis Month, and there's nobody better. There's no one who's been working with osteoporosis for so many years, and you bring such a wealth of knowledge and experience. So I'm just so excited to have you join this community and really enlighten us to so many things. So welcome, first of all.
Well, thank you. It's so wonderful. I love this invitation, and I welcome any opportunity to talk about how we can manage osteoporosis.
Well, it's so great. So you've been working with osteoporosis and have the specialty in bone health since 1984. So let's start with how did you get started down this path?
Well, I had been a therapist. I graduated college in 1962, so I had been a therapist for 22 years. And I had never seen a patient with osteoporosis or certainly with an acute compression fracture. And one day in the clinic, I was working up in my hometown in a hospital outpatient clinic, and a doctor called me up and he said, "Sara, I've just admitted a patient, 65-year-old female, with osteoporosis and an acute compression fracture from a fall down a flight of stairs. And you're the expert in this area, so I'm going to turn the care of this patient over to you." Well, I had never seen a patient with known osteoporosis, and certainly not with an acute compression fracture. So I did not then, and I do not now, consider myself an expert in anything like that. Nevertheless, I took up the challenge, and the first thing I did, I, of course, went through the patient's record, her chart. I looked at her x-rays, and I could clearly see the wedge fracture in the mid-thoracic spine on the x-ray. And then I went to my Gray's Anatomy that I still had from physical therapy school and reviewed the anatomy of the spine. And knowing that from some of my other studies that the first rule of fracture management is to reduce the fracture, I said, well, I have a compression fracture from too much compression. Therefore, it must be that I want to decompress it. So what would be the best thing to do? Well, I looked again, of course, at the x-ray, and I decided that the supine anatomical position would be the best. Now, this is back in 1984 when a patient actually got admitted to the hospital, and she actually got to stay there for a few days, so I got to work with her. And so she was lying flat on her back, not at the mandatory 30 degrees that's now mandated in so many hospitals. She had a roll under her knees and the smallest pillow she could possibly tolerate under her head. So we've taken a 65-year-old grandmother, active, she's still working as a bookkeeper. She's driving her grandchildren all over to different events and picking them up from school and so on. And now she's flat on her back. So we have to give her something to do. And so I figured that what I would start is with isometric. I've also read that about fracture management. It's best to start with isometrics. So I designed a series of exercises, which are called the realignment routine now, to strengthen the back extensors, the neck extensors, the hip extensors, the muscles basically that hold the body up against the force of gravity. And also she was in quite a lot of pain. So I had an assistant and we did modality work with her. We saw her 3 times a day. And I would know now to begin with ice with an acute injury. However, I know that people don't tolerate ice on their back very well either. So we used moist heat packs and electrical stimulation with pad electrodes right at the fracture site on either side of the spine. And we did that once a day. We saw her 3 times a day. We did the exercises, the stimulation once a day and the exercises 2 to 3 times a day. She stayed in the hospital for 10 days, unheard of today. And then we continued to follow her up as an outpatient. She came basically into the clinic as an outpatient, and she lived in the same little town that I did. So I also saw her in her home, so I could work on ADLs right in her own environment. And this woman returned to her pre-morbid condition. She went, she's driving, she's working, she's taking care of her grandkids, the whole thing. And so then the next thing that happened with her was that I had a chance to look at her follow-up x-ray in 6 months. And you could clearly see, I could see on the x-ray, the increase in the height of the vertebral body at that 6-month period. So I knew I had had a good result. And then I began to look around at my patient population. And I thought, wow, I'm tending to focus on geriatrics. That seems to be the area that I like to work in the most. And as I looked at the posture on my patients and the way they were moving more closely, it occurred to me that probably most of them also had osteoporosis. So I began to use this exercise program, which is my original work, for them. And it was amazing the results I was having for back pain, no matter what the pathology was and so on. So that started me on the path. It was one patient. So one of the things I always like to mention in my seminars to therapists, such as yourself, is that you listen to your patients, because you will learn from your patients. And it's an amazing path. That patient, if I hadn't seen that patient, I might not be doing this today, but that's where it all started.
Wow. And the thing is that you start, I mean, what I think is just so fabulous, it wasn't, Sarah, that you just, okay, I'll deal with this patient and I'll work on my own practice. But then you took what's now known as the Meeks Method, and you've taught this to therapists and exercise professionals, all over. So it's something that really everybody knows today. Everybody in the field of physical therapy knows the Meeks Method. So here one patient started you on this path, but then
that's correct.
Because of your teachings, you didn't just take it there, then you trained others so that all these beneficial effects can really be spread to everyone. So I think I just give you so much credit for continuing the work and going on and really going to the next level to teach others who can continue to pass it on.
So let me just tell you a little bit more about that, because, as I worked in that clinic, and then what happened, I got married again. At the time I was not married when I met the patient, but then I got married again. And then my husband and I moved to Florida. And so I was working in home care, and it's in the home care population that I really say that I really could develop the program, because there you have a population that really needs something that's going to take them into better function. And then I had an opportunity in this sounds like ancient history, 1996 and 1997 to work in a clinic where every patient had been diagnosed with osteoporosis or osteopenia with bone density scan. And it was my chance to really focus on that one diagnosis. Now, in that clinic, of course, I saw patients coming in that had everything else that we typically see in a physical therapy setting. They had joint replacements, they had MS, they had COPD, they had just anything that you can imagine. They were almost all women because it was a women's health clinic, but the owners of the practice did have another clinic, and I did see a few men, which really surprised me because um, osteoporosis has always been said it's a woman's condition, an old woman's condition. It's far from that. It's far from that. It affects men, women, children, young people. Babies are being born with it in this country with osteoporosis. We're seeing it in infants and small children. And basically, no one is immune. Some are more at risk than others, but nobody is totally immune. But I had that opportunity. And then what happened is I had a colleague, a really good friend of mine. We used to run marathons together and all kinds of things like that, a physical therapist. And she said one day, she said, Sarah, because I worked in that clinic about 14 or 15 months, and then I left and went back into home care. And she said, you've really learned a lot about this condition of osteoporosis. I said, yes, and a lot of it really surprised me. She said, well, you really should go out and teach other therapists, So I hadn't thought of that. I said, oh, well, okay, let's try that. So I developed the course. I sent out a mailing to the therapists in Florida, and people came. So that started the whole thing. And I'm, now in the time of the COVID crisis here, of course, we're not doing on-site. I'm hoping that we will be able to go back to that some way in the future. But right now, most of it's online and so on. But I'm still teaching and doing webinars and so on. And it's on this subject. It's like my husband says, I sleep, eat, live osteoporosis management, and I'm still learning.
Well, because really it goes way back. I mean, way back, when the time we're talking about, people weren't, they didn't even have medications at that point that people were on, so we're going back before really even the medical community was doing much about it. So that's great. So Sara, tell us, you have so much experience. You've worked with so many years with people with osteoporosis. What would be the most important things you'd like to tell people that you would just like people to know about osteoporosis that really, you want to enlighten people too from all these years working with this population?
Well, I think the first thing I would like people to know is nobody's immune. That there are some people that think, oh, I could never have it. Well, I just got an email from a 43-year-old male patient who had to convince his doctor that he wanted to have a bone density test because he thought he had his osteoporosis. And the doctor said, oh, you couldn't possibly have osteoporosis. Well, he got the test, and guess what? He has osteoporosis. So a lot of people get surprised by that. I would like people to think that taking care of bone health, and what I tell therapists in my seminars, I say, when you bring the bones into the equation of exercise, your practice will change. Because if you look at it from safety for the bones and also therapeutic intent for the bones to strengthen the bones, things change. It changed for me overnight. And it was an amazing change. So that's, I guess, the primary thing. The other thing, people think they can prevent osteoporosis. Well, they're showing in research now that prevention of osteoporosis begins before birth, in utero. Babies are being born with the condition. So that therapists need to be targeting women and men of childbearing age so that they bear healthy babies right from the get-go. I also want to let them know there's quite a few things that are the couple, 2 or 3 most important things. Most of the fractures that occur, this is the big injury in osteoporosis, are silent. Most of them occur in the spine, in the mid-thoracic area. That's between the shoulder blades. And up to 80% of compression fractures are silent or accompanied by such a trivial symptom nobody would suspect a fracture. But when you have a fracture, the alignment of the spine begins to change immediately, and it puts more compression on the heart and the lungs. And the primary causes of death in osteoporosis are pneumonia and heart attacks. So that if people start to lose body height or an increase in the kyphotic posture of the thoracic spine, that what they call the dowager's hump, I don't like that term, but that's what they call it, that those are a couple of the classic signs. And if they have a fragility fracture in their wrist or their ankle or their foot, one of the long bones in the foot, that's a classic first sign that you probably have low bone mass, whether it's osteoporosis or osteopenia, whatever. But any fall from a standing body height that results in a fracture, that fracture is a fracture of minimal trauma, and that is a first sign of low bone mass. And these people should get tested.
Oh, that's
so I
great.
guess that's a lot of, the most important thing. But, a lot of, like they say, well, osteoporosis is a silent condition until a fracture occurs. So I say osteoporosis is a silent condition until a symptomatic fracture occurs, because we're not picking it up with the silent fracture folks so much.
It's so true, because a lot of people think, oh, that just happens with age. Everybody's posture isn't good, and that's just how it happens. And they don't realize that these are silent and that we really do need to know about our posture. But I love what you said about at infants. And I really, that's one of my goals too, is to get it on the map. Every doctor should make sure at every age, people are doing things for their bones, just like we prevent heart attacks and we make sure people are doing things for other areas of their body. Osteoporosis is the same way. And I know that it's not something, I know we're all trying to get the word out, because we could prevent things if we started way back.
It's not easy. The osteoporosis is more prevalent than uterine cancer, other cancers, heart attacks, cardiovascular conditions, and so on, but it gets missed. It doesn't seem to be that important. One of the things that doctors could do, since you brought up doctors, is they could measure people's body height, because body height loss is a classic first sign. There's no number I can give you about how many inches. They say that 2 to 2.5 inches loss of body height might indicate a fracture in the back. Now, I've seen a patient with more than 10 inches loss of body height. That person definitely had several compression fractures. But when I go into the doctor's office, how do they check my body height? They ask me how tall I am. Or do I think I've lost any body height? Well, how would I know? I mean, I know because I test myself, and I get it tested, but the average public wouldn't know. So I think that's one thing that doctors could do, is measure body height and measure it, on a device that is valid and that can get a good measurement on, instead of asking somebody how tall they are.
Right, because people lie all the time how tall they are.
Oh, they lie. Oh, let's see. What shall I say today?
Yeah, that's such a good point, because what could we do? Let's say, what do you think we should do to prevent it? If we had, or what should everybody do? What types of things do you think everybody should do to prevent?
Well, the thing is that we have an increasingly, I would say, sedentary lifestyle is probably one of the big risk factors. That our babies, and it starts right at birth, our babies are born, they leave the hospital in a car seat. Now, look, I'm in total support of car seats. They prevent deaths in case somebody's in an accident. But then what happens is we keep the baby in a car seat, a portable car seat, and carry them around. Some babies are in a car seat 8 hours a day, and that's too much. We start the sedentary lifestyle right as the baby leaves the hospital. And then, of course, we're not allowing our babies to get prone position because of a lot of reasons. And I agree with the SIDS that they shouldn't be positioned prone in the cribs, because there have been a lot of deaths. but babies need to get prone to play and supine around their back to sleep. But that's not happening because we have busy parents who, can't always watch what their babies are doing all the time. So that's a problem. And then we go to school and we sit in school, and then the kids come home and they sit and they play with their little devices, their handheld devices. They're not playing outside as they used to. And then we grow up, and a lot of people are in office jobs. They're sitting a lot. And then they retire and they sit in their recliner chair and watch television. So it's like birth to death, from one end to the other. We're not moving enough. So I checked with a researcher on this, on bone density and the use of a vibration impulse for the bones, which is very effective. And I asked him about this, about, what's happening with our babies. Do you think that affects and causes more bone loss? And he said, I can't really say that because I haven't done any research. He's a dyed-in-the-wool researcher. He won't say anything without evidence. That's a good thing. He said, but I will say this, movement is good. So people generally need more movement.
Yeah, that's so important. And the interesting thing is, I know when I had my kids, they didn't have something like, once you had to take them out of the car seat to put them in the stroller. But now they've made big improvements. So now you can take that same car seat and snap it into the stroller. So you don't even have to take them out for a minute.
That's right.
Where they could stretch. They can just stay not moving from the car directly into the stroller. So you're so right about that. And I think young mothers are busy. I remember how busy it is, and they're not thinking. It's not on the doctor. Nobody's told them that, it's really good as much as you can to get them on their stomach. And just like you said, so I think that's such an important point. You said a lot of really good things. So I think that's so important. And then the other thing. Yeah.
The other thing to bring up is that the American Academy of Pediatric Physicians has said that the baby should be taken out of the car seat when the car is parked, and the baby should be carried or laid flat in a carriage or something like that. But, it's like clip in, clip out. The baby just stays, especially if the baby's sleeping. You never want to wake a baby.
Right.
Baby. So that's kind of what happens. But I think, there's also many, many side effects of being in the car seat, not the least of which, the most important one, I have read 2 research articles that were done over in France, and then there's another more recent one, not sure where that one was done, that shows that babies are not getting sufficient oxygen when they're in the car seats. That as soon as the baby is placed in the car seat, the oxygen saturation begins to drop within an hour, and then within 2 hours, it goes down even more, and it doesn't matter if it's a preemie or a full term, it happens in all the babies. So with oxygen being our primary fuel for our body, basically, we're depriving our little babies from oxygen, and that will affect development. There are other issues of delayed development, of torticollis, of GERD, of I can't remember all of them, but there's quite a few side effects. And the way that we're treating them, the GERD particularly, they usually give the medication in the formula. And the medication is usually Prilosec, which is a proton pump inhibitor and is a risk factor for osteoporosis. So there we have the baby sitting, not moving, and being given a medication that is shown to be a risk factor for osteoporosis. So, no wonder we have a problem with bone health. Yeah,
I know. I mean, you bring up a couple things. Also with that Prilosec, I mean, so many people, every age, are on these proton pump inhibitors.
Yes.
And it's blocking the acid, which temporarily may give you a little bit relief, but we need an acidic stomach to really absorb our nutrients. So it's something that really does need to be changed, and people need to be aware of it.
I'm just going to throw this in here. I'm not a doctor, but I decided years and years ago, and I know you're an advocate of a natural remedies and management of this condition. I decided many, many years ago that unless it was a life-threatening condition, I wasn't going to take any prescription medication. So in my travels, I did have some issue with GERD because I was sitting a lot on the airplane, especially I flew to Australia. That's a 16-hour flight. That's a lot of sitting for me. So I discovered papaya. So I have these little papaya pills that I keep handy that if I ever I don't have it on a regular basis, just mainly when I travel and I'm sitting more. And I just take a couple of those and bingo, it goes right away.
Fabulous. Yeah,
So
that's
that's
fabulous.
my prolacin.
That's great. Well, the truth is, there's so many natural remedies and there's so many things people can do. And
Yeah.
I really believe that should be the first line of defense before people ever get put on these medications. So that's so great. The other thing that I wanted to just go back to was with children, what you're saying. And now with the texting in that position, they're actually calling it text neck, and they're showing changes in the vertebrae, in the shape, just from the
Oh,
texting. So it's so,
oh,
this is just
oh, if you
critical.
have a reference for that, I'd love to see
Yeah.
that.
Oh, sure. I'll send
I
that to you.
know.
Yeah.
They say, well, kids will outgrow things, uh, but maybe not, depending upon, there's such a thing that they call it tissue creep, that our tissues actually change according to our posture. And so if we're in a sustained posture for a long time, we may or may not grow out of it. If you get my drift, it may happen and it may not. But that also has to be addressed, the use of handheld devices and so on, because it's a real problem with our posture. And people don't think. I came across a yoga teacher once, and she said, we were talking about this, and she says, the way I teach yoga, I tell people to move and do exercise and give their internal organs more room. So you think about the front of the body. How can you lengthen the front of the body? How can, because when you're bending over your phone, of course, you're compressing the front of the body. So give your internal organs more room.
Yeah, that's a good way to think about it. Absolutely.
Yeah.
Well, your posture exercises, I've been at some of your courses, and it's amazing because you work with really people of all ages, but you work with a lot of older people with real significant postural dysfunction. I mean, real problems. And I cannot get over from the work you do how improved people can get. And I think for everybody listening, that's exciting because there's so much room for improvement regardless of where you
Oh,
start.
yes.
And you want to just talk about that because you're
Well,
really the queen of this, of taking
yeah,
people who are, yeah.
I will tell you my star pupil, he's no longer living. But I was seeing him as my home care patient, and he had a condition called Pott's disease, which is TB of the spine, when he was 8. So he had a thoracic kyphosis, more than 40 degrees, definitely. And he had that for 86 years. Basically, now he's 94 when I'm seeing him. I was seeing him because at the age of 94, he was on one medication, a blood pressure pill, and then he was having trouble sleeping. They prescribed a sleeping pill. He fell out of bed, and he had a fracture of his shoulder, his left shoulder. And now people think that it's very hard to change postural alignment. Now, this is a man who's worn every brace in his whole lifetime, all of which are in the closet or under the bed. They're no darn good. They don't do any good, and he doesn't wear them. So in any case, with the realignment routine, which are the basic exercises of the Meeks Method, I was able to change his posture within an hour.
Wow, that's
I have
incredible.
pictures. I have pictures of him. I took a picture of him before we did anything, and then and I said, now James was his name. I said, stand in your usual posture, and you can see his kyphotic posturing and everything. And then I'll say, now give me your best posture. Supposing you're going to a party and you want to look really spiffy, how would you stand there? And so he kind of straightened up a little bit. Then I worked with him for an hour, and the change is like miraculous, and it's so simple. The exercise is, should I mention it now?
Sure.
Those of you who are watching this podcast, if you contact me via my email, which is jharrison, HARRISON, and then the number 2, so jharrison2 @earthlink.net. I continually revise and kind of revisit all of the work that I do, and I'm working on editing that particular routine right now. if you contact me by email and tell me that you contacted me because of this podcast, because I get a lot of email, put it in your subject line. Make sure you have a subject, because otherwise you might get deleted. So, and I will send you a copy of that exercise routine.
Oh, that's great. And right now, with so many of us being stuck at home and really not getting out, this is more important than ever. And so many people are at their home office that really isn't so comfortable, and so I think this is a perfect time for your realignment. That's great, Sarah. Thank you so much.
Well,
and I'll have that also in the links so that
I
everybody
will
in the show
tell
notes.
you that it's not everything you can do it, but it's where I start with people. I start everybody with the same thing. And basically, it's learning how to lie on the back. And some people say, learn how to lie on my back? Why do I have to learn how to lie on my back? Well, I've met people who haven't been on their back in 20 or 30 years. They have to learn how to do it again. They've gotten used to sleeping on their side or lying on their side, and that's what they do. And they always lie on the same side. But they may have to work on that. So as long as we're on the topic of exercise, could I just mention a couple of other things?
Oh, sure.
One of the things that I tell my patients, and I think it's that I've written it out, do not self-select your exercise program. If you get diagnosed with osteoporosis, don't think that you can just go to anybody or read a book or go find a video on the internet or whatever you do and self-select your own exercise program. A lot of it out there can be dangerous. The flexion of the spine is contraindicated because of the risk of compression fracture. And so it's better to look up a health professional, preferably for starters, a physical therapist who's trained in the management of osteoporosis and knows about the contraindications and also the dangers of doing other exercises. In my program, I focus on what I call, at least the beginning, the muscles that matter, the ones like your back extensors, which help to keep your back and your head upright. And the strength of those muscles has been shown to reduce your risk of fracture. And also the core muscles of the abdominals, mostly everything is isometric. And the pelvic floor, the diaphragm for breathing exercises, and then of course the extensors and abductors of the hips. So those would be the primary ones. And then of course we want people out and walking, so they exercise their heart and lungs. And that's a place to start. It's not everything, but it's a place to start.
I think the important point, and I think what's so great about your whole routine, is that you're really getting people in alignment, because when we live our life out of alignment, we're putting every part of our body at risk. So not only this will help your bones, but it's going to help your knees, your hips, your toes, your shoulders, every single thing, your head, your TMJ. It's so important. And I think people sort of don't realize. I just think people are walking around, they're busy. They're not thinking, oh, where's my head? Where are my shoulders? Oh, my posture isn't so great. Oh, everybody's posture is bad. And I feel fatigued at the end of the day. Oh, everybody does. No, it doesn't have to be this way. Right, Sarah?
Well, that you hit, I guess, probably the bottom line. I have a lot of bottom lines, unfortunately, but alignment of the body is basically a bottom line. Because now I don't say normal alignment or good alignment or anything like that. I say optimal alignment. What is the optimal alignment for you with your particular structure? Not everybody's the same, but we have certain guidelines for it. With better body alignment, you have the two forces on your bones that are the most important for healthy bones are muscle contraction and weight-bearing forces. Now, so if you have better alignment, you'll have better muscle contraction where it matters, and you'll have better weight-bearing forces going through the bones. Now, weight-bearing, just for everybody's information, because a lot of people think weight-bearing is going into the gym and lifting weights, or sitting on a machine in the gym and lifting weights. That is not weight-bearing, that's weight training or weightlifting. Weight-bearing is bearing your body weight through your skeleton, through your bones when you're standing. You can do it on your hands and knees, or when you're kneeling, or whatever position that you're in. Even when you're sitting, you have weight bearing on your spine. So it's not lifting weights or just going in the gym and using the machines. But those are the two primary forces on the bones in exercise. So the better alignment you have, the better off you're going to be.
Oh, that's great.
Yeah.
You know what I would love for you to share, because I think it's so helpful. One of your little sitting exercises that everybody can do while they're listening to this, as long as you're not driving a car. The one with your feet, you know what I'm talking about. It's a really great tip that people can do. That's so easy to give them more alignment.
The perch posture.
Yeah, why don't you tell what to do with your feet during the perch posture?
Oh, the perch.
This is great. I love this.
The feet. Well, you said something about driving the car. You can't really.
No, I said not. It said if you're driving the car, you can't do this. If they're listening to us,
okay.
No.
Okay.
But if someone's just sitting, this is such a good tip. So why don't you tell everyone about the perch posture?
First of all, most of the chairs and tables that we sit in or sit at are too low for most people. So it's a good idea to sit a little higher. It's called the perch posture because the more you open up your hips, most people will say, well, you should have a 90-degree angle at your hips. Well, if you have 125, that shows you have less compression on your spine. So what I encourage people to do, I teach them the perch posture, which is to sit on the edge of the chair or on the corner of the chair, because then they're sitting on their pelvis. And then I say, now, feel your feet on the floor. You want the feet, right?
Yeah, I want what you tell people because it's so good. It's so good.
And then you make you have your feet on the floor, flat on the floor, and then you bring your weight back on your heels. I'm doing it now, and then run your weight up the outer border of your feet, and then across the ball of the foot, the metatarsal heads. You should be able to wiggle your toes. You don't have to wiggle your toes, but you should be able to. No weight on your toes. That's called the foot triangle of support. And then imagine that the floor underneath your feet has turned into a slab of wet concrete, okay? Take a breath in. As you breathe out, press your feet into the wet concrete as if you're making a mold that looks just like those bones of your feet. And then feel the lengthening in your body that happens. Pressing down lifts you up. Newton's third law states that for every action, there's an equal and opposite. So when you press down, you trigger muscles that lift you up, improve the alignment in your upper body.
I love that. So I think everybody, once you do that, just put that into your life because it's so helpful and it's so easy, Sarah. It's such a great tip that really.
I'm doing it now. I'm standing.
Yeah.
I'm standing. You can do it standing. Standing on line in the supermarket, right?
It's perfect.
They hired a new cashier and she's really slow and you're thinking, oh my God, I'll never get out of here, blah, blah, blah. So anyway, I'll just stand there and I press my feet in, I can feel my body and then I focus on my breath and before long I'm out of there.
That's great. So before we end, because we could talk forever, but you've worked with people. I would like, and you've seen the effects when people do exercise. And so what have you seen all these years of people? Because, a lot of people think that, oh my gosh, I got this diagnosis of osteoporosis, my life is over. So what can you tell us? Because we both know that's not the truth. Okay. So maybe give us, because you've worked with people for so many years, I would love for you to share some of your great stories or just to share to people so that they know that that's not the case. And this is like a wake-up call and good things can happen.
Well, I do. I see, and I also do phone consults and Skype consults, and I'll probably start to do Zooms too, but I haven't done those yet. But anyway, I meet a lot of people that way who are very anxious and they're frustrated and they're not getting good advice and so on. So the first thing I tell them is you can lead a complete life free from the fear of falls and fractures using my method. Now, there may be other methods out there. I don't know. This is what I've developed, and it seems to work for a lot of people. So it starts out fairly simple and then can get more complex depending upon where you want to go. Not everybody wants to go into the gym. You don't have to go into the gym, but you need to do something to take care of your body. And you can do this. You can do this. And, they kind of, say, oh yeah, sure, and so on. But as soon as they do that first exercise, I get them on their back in that decompression position, and I have to support them in certain places, a lot of them, and sometimes it takes, support, get them out of pain. And I say, now, there you're doing your first exercise. You do this 3 to 5 times a day. Most people aren't doing very much now, go back, lie on your bed, get on the floor if you're safe getting on the floor, and just lie on your back for 5 to 15 minutes. I usually say 3 to 5 times a day because that means they'll do it 2 to 3 times a day. If I say 2 to 3, they'll do it 1 or 2, so I give them a
These
little
are
bit
tricks.
more.
These are tricks of physical therapists, right, Sarah? Right. Unless it's a type A person, then you can't give them because they'll do it 10 times more.
Yeah. Well, it's, and I probably should put this in. One of the things that I really do very consciously, and I've been doing it probably my whole time in physical therapy, not sure, is listen and watch. Watch how they move. Listen to what they say. Listen to what they want to do. Now, if somebody comes in and they tell me they want to run a marathon, I say, okay, well, let's see how far you can walk now. We have to start someplace. So we have to have goals. But I want to hear what it is that they want to be able to do so that I can design a program that they will do. If I listen to them and then I design something that they'll do and that helps, lying on the back, the way that I have people do it, is the single best exercise for most back pain. That's it. You lie on your back. I do it all the time. I do it 2 or 3 times a day myself. I'm standing here now. I can see I've been standing in the same spot for this whole interview so far. I can feel that my my sacral area is starting to kind of talk to me a little bit. So when I get finished here, I'll go and I have a special table that I see patients on. I'll lie down on that table and I'll lie on my back for 5 minutes, 10 minutes and get up and I'm fine.
And that position will be in the exercise that people can email you for.
First one.
Perfect.
First one. That's
perfect.
Yeah.
Well, anyway, yeah, but I think the thing is that both Sarah and I have worked with patients for a long time, and the good thing is that there's so much you can do, and I think that's what we want to leave people with, that the posture is important, and you've given us so much important information. But Sarah has worked since 1984, and people are doing well, so it's exciting and it's encouraging, and it's not doom and gloom. And when they improve their posture and their bones and their strength and their stability, their life becomes better, right? And they're active and doing things at all ages. So that's what's so great.
Do I have time to teach a little breathing exercise right now?
Sure, okay. Absolutely.
Well, I'll just do it standing. You can do it standing. And I usually teach breathing exercises standing because I can demonstrate well what to do, okay?
Great.
So those of you that want to do this, you stand, and you don't want to stand with a really wide base. You want to have your feet sort of underneath your hip joints. And then you take one hand and place it on your belly button or just below. And then you take your other hand and place it around in your lower back. That's it, okay? Now you have to have standing. If you don't have the standing balance to do this, you can do it sitting or perching on the edge of your chair. You don't have to stand. But, and then what you do is, as you breathe in, you focus on the hand that's on your belly button and you press your hand away. You imagine you have a balloon in your belly and you blow up the balloon. So as you breathe in, when you breathe out, you deflate the balloon. You can press in with your hand. Now, the idea of your hand behind your back is that you don't want to move your back. You want to keep your back still, okay? So it's just inflating the balloon, deflating the balloon, inflating the balloon, deflating the balloon. Now, don't tell anybody, but that's a diaphragm strengthening exercise. That's one of the first things I give people to. You can do it anywhere. You can do it. You lie down in your bed to get ready to go to sleep. Just pause, lie on your back, blow up the balloon, deflate the balloon. That's all. Just think about that. Don't think about the diaphragm or anything like that. Just blow up the balloon and deflate it. You can do it standing on line in the supermarket. You can do it when you're driving your car. I don't know that there's any place you can't do it.
That is so great and so important. And guess what else is going to happen? It's going to reduce your stress.
Yes.
So
Oh, yes, yes,
yeah, so there's
yes.
so many benefits. I love that, Sarah. And as I said, I could talk to you for hours because you are such a wealth of information. And I can't thank you enough, though, for what you've done for the profession of physical therapy, as well
Okay.
as there are people all over. So if people are listening and they go to a gym and someone has had the Meeks Method, they've been trained, because you've trained exercise, yoga
Yes.
instructors, then you know that that person has had major training. Do you have a list by any chance of
A
people?
list?
Yeah. No,
Well,
right?
right now there are about 11,000 people on it. Yes.
Wow. So it's just to
I,
know that the Meeks Method, if someone, people, I mean, if people have say that they're Meeks Method trained, then you know that they understand the precaution and they've had this
yeah.
really significant training. So it's just something to know.
Well, precautions. Interestingly enough, in 1984 was when I saw my first patient. That is also when Dr. Marshid Sanaki of the Mayo Clinic published her landmark article that showed that spinal flexion exercises increase the chance of compression fracture by 89%, which means that people with osteoporosis should not do abdominal crunches. They should not bring their knees to their chest. They should not do straight leg raising. They should not bend over to touch their toes, anything where they're rounding the back. That increases their chance of fracture substantially. Now, the question becomes, well, that's what I can't do. Now, what can I do? That's where my method comes in.
Great. And the thing is, it's funny with that article because for years when I would talk to people or I'd give a lecture or something and there were yoga instructors, they were like, or they would go back to their yoga instructors and say, you are absolutely, that is not correct what you're saying. So I would have to send that article to people because they didn't, my yoga instructor said you are not correct. So I send that article to so many people you
I
can't
know
imagine.
how it is with the yoga instructors.
But you teach safe yoga, so it's so good. So Sarah, as I said, I could speak to you for so long, but this has just been so wonderful. And I really thank you from the bottom of my heart for all the work that you've done. But a couple things, I know you have a new book that you're working on right now.
Yes. The mountain posture in yoga?
Yes,
You know
yes,
the
yes.
mountain? Okay, basically Tadasana. And basically what is Tadasana? Standing in optimal body alignment, right? So I call it the walking mountain. Or the mountain in motion. The motion. I
Oh,
use
love that. Love that.
the
That's a
mountain
great.
in motion. And it's basically yoga, what I call yoga and yoga inspired movement for osteoporosis.
Oh,
Better
when is
bone
this
health.
going to be out? When do we think soon?
Well, actually, I was hoping that I would have enough of it done by the end of this month that I'm going to send it to somebody. Somebody said that he was going to do a testimonial for me. So I need to have it done pretty near the end of the month so I can send him a copy of it so he can see what it is and he can write his testimonial. And then it'll probably need a little more editing after that. By the way, my daughter is a hotshot editor. She has a degree in editing, professional editing. And so she's been working on editing and, fixing up my fonts and kind of, checking for typos and all kinds of stuff and sentence construction. I'm pretty good at it too, but, she's better.
Lucky you to have a daughter who's an editor. That's great. Well,
Oh.
I'll also, you know what I'll do under the podcast? As soon as it comes out, I'll put that link so that it will just be there with your podcast, but also that, we can let people know. That's great. So that's very exciting. And again, your courses, I guess when people email you, they can always, I'll have your website too. Give them your website, Sarah.
Well, the courses are kind of on hold because we're not able to do any on site. We've done one online, which needs some work. So we're kind of, in that change period of how exactly this is going to work. I'm hoping that once this COVID crisis is over, that we can go back to on-site training because I firmly believe, and the feedback that I've had over the years in my seminars, I ask the question, do you prefer on-site or online? On-site wins, hands down.
Oh, well, sure. When they can work with you, and especially when we're working on the body. So,
Yeah.
all right. So we'll have all that in your website, Sarah. You want to just tell everybody?
I'm sorry?
You want to just tell everybody your website too?
Yes. The website is www.sara, with no H, SARA, Meeks, MEEKS, PT, as in physical therapist.com.
Great. So we'll have
www.sarameekspt.com.
all right, so everybody can follow up, and we're excited for your new book and all the work you continue to do. But again, thank you, because you've made such a contribution to physical therapy and really to the world. So your work has just helped so many people over the years, and thank you for sharing your wisdom with all of us today. It's just been such a pleasure. So thank you for being here.
Okay, well, thanks for inviting me. This has been fun.
Yeah, and look forward to staying in touch.
Yeah.
I hope you've enjoyed today's interview with Sara as much as I have. And make sure to try the tips that she went over with sitting and breathing. If you send Sara an email, she'll forward you her beginning exercises called the realignment routine, which is part of the Meeks Method. So all the links will be in the show notes, and I look forward to seeing you on the next episode. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.